talk about a patient who presents to us anywhere from 16 to 20 months following completion of their radiation treatment, and they have consistent lymphedema, oftentimes in the submental region or in the anterior neck. If that patient has had a decrease in their initial measurements, anywhere from that 3 to 7% from the 3 months post-treatment to now, to date, that's why we want to take those neck measurements. And that decrease, they're able to keep that tissue as soft and as movable as possible. They're highly compliant with the components of CDT, complete decongestive therapy. They have exercises in place. They utilize a garment. They reach out to you or the company when they want to know, what can I do about my garment? And they are managing with their own independent manual lymph drainage. They're managing their routine appropriately. What do we do? What's our role as CLTs? Well, our first goal is exactly what you all are thinking. We want them as independent as possible. If that patient has been able to reach all of their goals, all of their independence, and they are happy, then they're on a routine. Can you see them for follow-up maintenance at 3 months? Absolutely. That way they have some additional questions, make sure they haven't fallen off the bandwagon with their exercises. But what I've learned is if somebody's doing their work 16 months post-treatment, 18 months post-treatment, 20 months post-treatment, and it's a part of their daily life, they reach out to me when they need me. They're still monitored by their ear, nose, and throat physician at that point within that first 5 years post-treatment. And their ENT will also refer back to me if needed, either for dysphagia intervention, lymphedema management, or check. Or they refer to PT for cervical radiation or range of motion fibrosis. And so those patients become really independent. Those are some of my favorite patients. Now the question has come up, what about the pump? If your patient is wanting to explore this option, I see no reason they should not explore this option. The pump may improve certain components in their quality of life, but it's also important to let them know what are their expectations in terms of change and what does the science tell us in terms of the size or the change. But I have found that setting up a consultation with the tactile pump and the team along with my patient, those are some nice areas to navigate at this time if that's something the patient is desiring. I let the patient take the lead in my world, and if they bring it up, I'm not a gatekeeper. My goal is to give them all of their options, educate them on lymphedema, the long-term side effects, what we can expect, and help them to improve the easiest way to manage that on a daily basis. All right. Go CLTs and speech pathologists with head and neck lymphedema.